Hello everyone, my name's Adam, I'm from Alto Hearing in the UK, and we're back today to bring you another earwax removal video from one of our clinics in the Midlands. I hope you're doing well. This is our first video of 2025, well, earwax removal video anyway, and it's been a really busy time for us at Alto. We've recently just opened our third clinic in a little town called Market Bosworth in Leicestershire, so yeah, it's been pretty full on, but it's great to be back here today showing you another example of some of the work done in our earwax removal clinics. So the clinician today is Mariia in Lutterworth. She had this lady in for a standard wax removal appointment, and on first glance this looks like a fairly routine one. There's quite a big skin peel in the first ear that Mariia takes care of with some crocodile forceps, nice and easy there. But in the second ear though, there's a lot more impacted wax, and this takes a bit more effort to clear out. Here Mariia is using microsuction, which involves using a vacuum to suck the wax out of the ear. She can see exactly what's going on through her endoscope, and what you can see on the screen here is exactly what Mariia can see on her screen too. The endoscope and microsuction is our preferred method of wax removal. One of the key advantages in using an endoscope is the amazing visibility it provides. It allows us to see right down the ear canal in far greater detail than other things. So when our clinicians are working, they can move with absolute precision. When you compare this to more traditional approaches that rely sometimes on guesswork or a narrower line of sight, such as with a normal otoscope, endoscopic removal gives us the chance to see exactly where the wax is located, no more, no less. And I love the sense of confidence that it brings, because when you can see precisely what you're doing, you can do a much more thorough and safe job. Microsuction is equally important in this process. For anyone who isn't familiar, it's essentially a gentle suction or a vacuum that helps us remove the wax without need for excessive probing or flushing. And that means there's less risk of pushing wax further into the canal, and it's generally more comfortable for the client. It can also be quicker, which is wonderful news if you've had enough of feeling blocked up and you'd like to get on with your day. We've had many clients comment on how surprisingly simple and fuss-free it feels. Some even find the sound of the suction oddly soothing. So this was quite a tricky one, as this lady was quite elderly and there were times at which she needed to take a break. And you'll see there's an awful lot of wax on this side, and actually it was quite tender in the ear. And the reason it was quite tender is underneath all that dark wax, you'll start to see a very pale white tissue in the ear, which is normally a sign that the body is trying to heal itself. In other terms, it's a sign of a present or recently present infection. Now, there's a little bit of bleeding, which you'll see, and it just points to the fact that this lady has been blocked up for quite a while. And behind this wax blockage, there's obviously been a bit of infection building up. At the end, the lady was actually starting to feel a little bit dizzy, but we do have a clear view of the eardrum, and it seems as though there is definitely some infection there. So we've referred this to a doctor to be treated, probably initially with some antibiotic ear drops. It does look quite sore, so I'm not sure how long this one's been like that, but once the GP's had a look, if they feel the need to make a referral to ENT, they will do so, and we'll follow up with this person to make sure they're getting all the help they need. Anyway, just a short one today. We'll be back for more soon. Thanks for watching, and see you soon.